Well, good morning again. This is Dr. Bill Wyatt with the American Orthodontic Society, and we're going to discuss another high-angle case here. It really looks worse than the other case, but is not as bad as far as a high angle is concerned. Now, in this case, we took out the first bicuspids and the wisdom teeth too to reduce the tooth structure so we could get it to lower down better than would normally happen. And she's got some functional problems, but not as much. But the eruption of one of the centrals is just hideously high. It makes it look terrible. So let's get going with it, and I'll cover it. But it's a little different from the other high-angle case. But as far as winning, we made this one look better, but she still got slight gumminess to the smile when she could put her lip down. But the young lady, I think, became one of the beauty queens in the high school. So the mother was happy with that, but she was fussing at me for the long term that I took in doing the case. Anyway, let's get going here on it, and here, now looking at it from the side, it definitely has the high angle case. The chin is down here and the nose up here, and the distance is a great deal more right there. She's holding her mouth open like that, and looking from the front, it doesn't look quite so bad. But the distance in here and here is a lot more, so it's way too far. It's too high, so we want to close it down. But you watch when we get through it, the jaw looks like it's about like that. And we got it to close down by removing some of the teeth. And you could have used blocks, which we didn't try to do. This go around, I hadn't done that. Looking at it from the front, it looks hideous. I mean, the one central erupted extremely high, and the palate is too narrow, so she's got a breathing problem that came with that. And so there's just a lot of regular orthodontics in this case, plus we removed the teeth, and that allowed us to lower the angle down too. So I'm going to go pretty fast. Now taking this high angle, this tooth right here, we're going to have to bring that thing down and get the gum tissue to come down with it, you see. And we got the laterals behind it. For its crowding and stuff, it's a mess that way dental-wise, but those are things we can do. And we widen the arches out some in doing that. So we'll bring this over and pull this over here and bring this tooth back down into that place. And just regular orthodontic stuff. And we took the first bias out, and the took her to take these off here and got the first bite, and we had plenty of room to line these lower anterior teeth up right there because of that. Now here it's looking, excuse me, it's looking a little better than it did, and we used occipital headgear in this case to elevate the upper teeth to kind of pull that up, and that will help reduce the vertical height in that way. And now it's looking better. The gum tissue around the high central is still not lined up with the rest of it. And a lot of this, we had to wait on some teeth to come in to get after it, so it took longer than I had hoped for, but it was a tough case to do. We took quite a bit more time than we normally would have to do the case. The gum tissue's way down on the side of the molars back here. Another thing that we had a little problem with. And now the arch, you can see this, the tongue is not pressing this out. So we're going to round that arch out a little bit. And we come in with an occipital headgear, and we pick the back teeth up to lower that, and that kind of brings that tissue down on the side of the 6-year molars back there. This was back before we had the the brackets, so we're using bands here on it, and we lined those up, and we're waiting on now the cuspid teeth to come in and the second bicuspid to fill that space up. We'll line these lower teeth up, and the vertical line to the face is reducing already. You can see that much reduction by eliminating the teeth. And you look at it from the front, and it's almost a normal height in there. In fact, it would be normal. And she smiles. She's got a little bit of a gummy smile, so she should learn to pull the lip down over the teeth. But she's a very pretty young lady. Now the high central, the gum tissue, you may have to trim sometime to get them to be matched up like that. Now we're working with just 6-year molars, and we'll get back with more orthodontic, and we had to wait on some teeth to come in, and so it took longer to do this case than it normally would, but you have to wait on the teeth coming in. And so we put it in class 2 elastics, pulling it together. And now I'm going to go pretty fast with it. It's totally banded, so we'll have a little difficulty closing all this band space and keeping the torque that we had on the teeth. This is closing out good though, and everything, and we've got you remember the ridges in here, they're kind of gone away now, and we've got a little more width to the arch right there, so that's more normal appearance. Now there's the way it was to start, and there's the way we finished it in 1982. That's like that. Went to that, to there, to there. And we put her in a bite plate to keep the teeth from closing down, so she bites up in here and she wears that. And sure enough, she got elected to one of the sweethearts in the high school. So that helped out the problem too. So there's 1973 and there's 1982. So there's almost 9 years there before we had finished her a good bit before that, but it's lined up good. And here she is after she got out of high school and she went off to college, or she came by the office and thanked me. And I was very appreciative of that. But we've got everything. I mean, she couldn't be any lower angle. That's almost ideal there. And looking at it from the front, it's good too. Little bit of gumminess to the smile. She could correct that by moving the lips, lengthening the lips. And so you can see the difference in the young lady. So you can do a lot for people, but if you're just getting into orthodontics and you've got a real high angle case, let somebody that's used to it do it, because you have to do certain things, or if you're just going there and moving the teeth around, that makes the teeth erupt and the high angle gets worse if you don't know exactly what you're doing with it. So thank you for watching, and I hope you learn to treat high angle cases, and that is a very gratifying thing, to change the facial structure that much by just doing orthodontics. Thank you for watching, and I hope you will join our group and subscribe. And so I'm going to close out here and we'll finish this up. Thank you now.